radiation therapy is a highly targeted and effective way to destroy breast cancer cells that may still be present after surgery. Joining us with details on the side effects is Dr. Kristina Mirabeau-Beale from 21st Century Oncology. Thanks for being with us this morning.
Thank you for having me.
So 70%, if you have radiotherapy treatment, 70%, that reduces the risk of it coming back by 70%, is that correct?
It does, yes, by two-thirds, more than two-thirds, as you said. Which is great. And actually, there's been an analysis that looked at several studies that followed women who had both surgery and radiation and showed that radiation actually improves overall survival as well, which is great.
Right. Now, there are side effects we want to talk about. What are some of the main ones?
So we tend to think of radiation side effects in terms of the acute, or things that will happen during treatment, versus long-term effects that can occur months to years after one has completed radiation therapy. So during radiation for the breast, the most common things are a skin reaction. That's kind of like a sunburn, so there can be some redness and soreness to the treated breast. And then also energy level, fatigue. So a lot of women can find that they can just feel a bit more tired during treatment, especially if they're getting 6 weeks of therapy. When we look at the long term, so many months to years after radiation, there can be some subtle changes in the treated breast compared to the untreated. So it can feel a bit more firm. There can also be some changes to the skin, almost like a little bit of a suntan. Another situation that we can sometimes have is what's called lymphedema, or some arm swelling on the side that was treated. That can be made worse sometimes if women have had surgery to their lymph nodes, and then based on some adverse risk factors in their tumor, they require additional radiation, not just to the breast, but to the regional lymph nodes as well. And then fortunately, one of the most significant side effects is also one of the most rare, and that can be any effect up to the heart and lungs. And we see that in less than 1% of patients, thankfully, because we have really sophisticated technology that can minimize the radiation dose to the heart and lungs.
So short-term and long-term effects, how can people deal with those the best way?
So in terms of the short-term effects, when it comes to the skin reaction, while a person is undergoing radiation therapy, they will be seeing their doctor weekly. And so the doctor will check in about kind of how their skin is doing and healing. And there can be creams that we can offer to help mitigate the skin reaction. And that can range from creams that one can pick up at their local drugstore to stronger things that require a prescription that your doctor can help you with. In terms of the energy level, it totally varies. You know, a lot of women getting treatment for breast cancer are very busy ladies. And so it can vary from, you know, just making sure you're taking care of yourself and getting rest, and also maintaining a healthy diet, and if you are a person who exercises, continuing to do that and trying to maintain some normalcy. When it comes to the long-term effects, for the lymphedema particularly, you know, prevention is really the name of the game. So as much as one can pay attention to if there's any changes in the size of their arm, then we can do massages or physical therapy. There are specially trained physical therapists who are able to really offer women good exercises or sleeves that can really reduce the size of the arm. So that can be very beneficial. And then in terms of the heart and lung toxicity I mentioned, really, thankfully, state-of-the-art technology that we're able to offer can really do image-guided, personalized treatment for women that's specific to their anatomy. So we're really able to spare the radiation dose to the heart and lungs, thankfully, and really maintain both good coverage of the tumor to make sure that we kill the cancer cells that are there, but then also really spare women any long-term side effects to their heart and lungs.
That's great, because every case is different. Typically, how long will patients be going through radiotherapy treatment?
It definitely depends on the tumor features. So some women are able to undergo what is known as a shortened course of radiation. That can be anywhere from 2 to 4 weeks of radiation. But the most standard treatment for breast cancer is about 6 weeks of therapy. And it becomes a very individualized discussion based on the tumor characteristics, the extent of the surgery, whether the woman needs chemotherapy or not, and also her age and other comorbidities or risk factors.
Okay, great. Now, after the treatment, what can these people do to really get back to their normal life?
So definitely being aware of the potential side effects and having a very open dialogue with your doctor. It's very important to not just have that awareness, but feel empowered to really advocate for yourself as a patient and seek out education. You know, before moving to Southwest Florida, I was in Boston at Harvard Medical School, and it was part of a study where we actually looked at, for example, lymphedema, the arm swelling I discussed. And we found that even though this was a series of over 1,000 women and only 10% actually had arm swelling, more than 50% were very anxious about having arm swelling. So in some sense, not just the side effect itself, but just the perceived anxiety about developing it can be very important to a lot of patients. And so having that open dialogue with your doctor, feeling comfortable really asking those questions, can really help your long-term survivorship and feeling very comfortable in your body as it heals after this therapy.
That's right. Ask those questions. Dr. Kristina, thank you. I'll call you Dr. Kristina.
That's perfect.
Thank you so much for coming on.
Thanks for having me.